Your teeth have a lot to do with your confidence. If you have a problem with them, it's very likely you're not going to smile.
Yeah, if you're missing any, it's difficult to eat. But having your teeth fixed can literally change your life.
And that's what Dr. Paresh is doing. Davy Sutton went to visit him in his office in Mooresville.
You mean when I wore dentures?
Deborah Aldridge wore dentures for over 30 years.
I had a dental technician that did not know what they were doing, and that's what started the deterioration in gum disease.
She was only in her early 20s when she started wearing them.
So you get used to them, you make adaptations for them, you learn how to, hold them in.
Until she was tired of them.
I did a lot of research, and I looked for other alternatives beside the dentures. So I was on my fourth pair of dentures that did not fit correctly, that were ill-fitting, that caused sores in my mouth, and I said there has to be something else.
She found Dr. Paresh from a simple internet search.
She's our typical patient that over the course of years, she's been told this is the best we can do. The denture is still never going to fit. It's just anatomically not possible to make something that's going to fit, stay in with where we are with dentures today.
After an examination, Deborah chose dental implants.
Knowing that I could have real teeth or as close to teeth as I would ever get, they'd be cemented in. I would never have to pop them in or out. That I could brush my teeth like a normal person.
If somebody says, Doc, I want to have teeth. I want to have teeth that are mine, that don't come out of my head, that I brush in my mouth, not in my hand, and that's what Deborah was asking us for. So we were able to put in implants on her and give her a set of fixed crowns.
What's the procedure for implants?
Typically what we do is we get the patient in, and this is a model we have right here, and we're able to go right through the gum tissue and place our implant, and within just a few minutes they're put in place just like you would install a screw in a wall. We put the clips inside of a denture. Once that goes in place, the two halves come together, and now that denture is not going to come out.
And the recovery time is only a few weeks.
The fact that there was literally no pain. I only used Novocaine and I only used Advil, and that was it.
We have the latest three-dimensional scanners at our office now that allow me to see how much jawbone is left. With that, most of the time I can place these implants without having to make a cut in the gum. So there's no sutures, there's no stitches typically, and we can get the implant in place, and then within a few weeks we're making the new denture for the patient.
It's been a year since Deborah had the procedure.
It gave me all the confidence in the world. People say when you turn 50, you're going into your second stage of life. Well, when I met Dr. Paresh, that's when I started.
She says her new smile allows her to do things that she's never been able to do.
It's apples and it's salads. Now I can do anything I want to do.
There's no reason to walk around with a missing tooth. The advances in technology have really lowered the cost for these procedures dramatically, so now we can start to see the acceptance of implants really going up.
Deborah says it's changed her life, and for that, it was worth the investment.
To know that I can go anywhere, do anything, regardless of what it is. I don't have to worry about my teeth falling out. Knowing that I can just be like anyone else, that is the best thing to me, and it's worth every penny.
Davy Sutton, Charlotte Today.
Yes, that is something to smile about. Thank you so much for that story, Davy. Dr. Paresh is offering a complimentary consultation at both his Lake Norman and Lenoir locations. Call 704-799-0552. The number again is 704-799-0552. Tell them you saw it on Charlotte Today. For more information, you can also check out implantsbyparesh.com. Implants by Paresh, that's Paresh.com. Thanks to Dr. Paresh for that.